Hey everyone, I'm Nicole from A Healthy Profit. I am a doctor of physical therapy, and today I am going to lead you through an at-home remedy and a full explanation of what is lateral epicondylitis, otherwise known as tennis elbow. Note before we begin, none of this is personalized medical advice. You should consult with your physical therapist or your physician prior to completing any of these exercises. Contrary to popular belief, it's not just tennis players who experience tennis elbow. It's oftentimes people who really use their wrist extensors and have repetitive movements of the forearm and the wrist that experience tennis elbow. I'd love to share with you guys some of my favorite remedies for treating tennis elbow. Take a look. It's a natural instinct of the body to want to rub out pain. So once you find that bone, oftentimes people have pain either at that bone, right above the bone on the supracondylar ridge, or right below the bone, or even in the muscle belly itself. Find your spot of pain, and once you find it, take your peace fingers, your index finger and middle finger, and strum back and forth. If your pain is in the muscle belly itself, you want to kind of knead the muscle like you're kneading dough. I showed you how to massage the tendon. You can use an ice cube and you can ice massage the area if that feels good for you as well. We are going to go in between stretching and strengthening for this first bout of treatment. You'll start your first stretch by flexing your wrist and then gently gliding it over towards the pinky side and adding over pressure. Make sure that your elbow is fully extended during this stretch. After you've completed your stretch in the Mills position, you will take a light 1 pound weight. You will place that in the hand. You are going to use your other hand, your unaffected hand, to pull the wrist up into extension, and then you will slowly lower down until the wrist is fully flexed and you feel that stretch. Next, I'll show you a few other exercises that you should go through that are not directly related to the extensor carpi radialis brevis, but is still important to strengthen. For example, strengthening your grip, strengthening your pronators, your biceps, and your scapular muscles. Gym goers, I would like to encourage you to take a look and examine what your wrist is doing during lifting activities. For example, here during this light bicep curl, you can see that my wrist is in neutral, meaning it's not flexed and it's not extended, as opposed to something like this. You can see here I'm doing this bicep curl incorrectly. I'm flexing and extending my wrist when I should not be. I should be keeping my wrist in neutral, meaning that my wrist is not doing any of the work. That's really common for compensations to move the wrist when you should be moving the primary muscle group that you're trying to work. I encourage you next time you're there to see how you're compensating with the wrist. The wrist should really never be moving in any position except for neutral, which means, again, not flexed and not extended. I often see this happen, and I'm guilty of it too, when doing a bench press. People will hold the bar in a bit of extension, which is going to strain your wrist extensors, which could, again, contribute to this tennis elbow. Especially also when squatting on the rack, our wrist almost naturally cock back into extension rather than in a neutral position. They kind of fall backwards. It's so much easier for them to fall backwards than hold them in a neutral position. So next time you're at the gym, check out how your wrist form is, because wrist form is just as important as the rest of our form in our body. The next thing that I'd like to talk about is posture. So in particular with elbow pain, your posture at your desk matters a lot. So if your keyboard is too high and you're typing with your wrist cocked backwards, that is going to lead to extreme over fatigue and repetitive movements of the wrist extensors, which can cause tennis elbow. So Be sure that your wrists are in neutral as you're typing at your desk. Your elbows should almost be at a direct 90-degree angle, and you should be able to find comfort in this position. Additionally, you should make sure that your desk is not too high so that your shoulders are not hunching up too tight. Your shoulders should always be relaxed down the back as you're typing and using the mouse at your desk. So be sure to find the right desk for you. I wrote a blog post about preventing pain while sitting at your desk, and I'd like you to check that out. I'll link that below. Another question I get asked quite frequently in the clinic in regards to tennis elbow is, should I wear a brace and should I tape my forearm with some Kinesio tape to prevent pain? I'll be honest, I'm not a huge fan of braces. However, I do support the use of an elbow strap at the beginning stages, especially if you're highly irritable in this stage and it's affecting your quality of life to the point where you feel like you can't even use your wrist and forearm. That being said, just please note that braces are acting just as a band-aid. A brace will never be as useful and efficient as completing the exercises which I already had showed you. Kinesio taping is a great way to inhibit this muscle from working so hard, as remember, tennis elbow is an overactivity, an overuse injury for the most part. So if we kind of want to shut down this muscle and let it relax, we can use a taping technique to do so.
First start with a big strip. Some people like to do a large strip with tails. I'll do both, with tails and without tails. Cut 2 holes in it for your fingers to go through so that we get more of an extension inhibition benefit out of the tape. Now you can just not do the holes and just put the tape across the top of the hands, but let's do it the way I've already pre-cut this. She's going to put her 2 fingers in there and we're going to work it down right in between the fingers like this, and then you just, no pressure on the anchors, right? We call these anchors at the ends. All right, apply the pressure there. Put her in full wrist flexion, all right? And then grab the rest of your backing on the tape. So kind of pull it up and over smoothly, all the way up to basically her lateral epicondyle. Boom, right to the painful spot. Take your second strip. All right, here it is, 2 tails. Rip it at the tails. All right, so now you have 2 tails, you got your anchor. Again, the anchor should kind of begin right at the pain. So right at the pain, you put your anchor, okay? So you're gonna, this is for pronation inhibition, so you're gonna want her to be in pronation. Bring it down and around.
Thank you guys so much for watching. I hope that this video helped you, and if it helped you, it will definitely help a friend too. So please share this video with your friends and family. Like, give me a thumbs up, and don't forget to subscribe to my channel and check out ahealthyprofit.com. Have a great day.